you know just before the interview what type of job it is that you're going for and what they are looking for in the job, so that you can show yourself to the best.
Topics in this video are online versus face-to-face interviews, questions on CV, clinical scenarios, part 1.
So my next question was about the online interviews. Nowadays there's a shift towards more online interviews, especially for international graduates. So how do you think online interview differs from a face-to-face interview?
I think there's a big difference with online and face-to-face, and I guess 3-4 years ago we probably wouldn't have even thought about doing online interviews, whereas now they've become a lot more of the norm, even for somebody who's in the UK. But I'm stealing something that Pregash said earlier, but the environment that you're in is absolutely key. You need to be somewhere that's quiet, that you can actually focus on the interview, nothing distracting behind you, no odd noises that are going to come in and change. So really think about where you're going to be, and you can concentrate on that interview and not be distracted and not worry that somebody's going to come in on you. Having said that, you then need to treat it as a proper interview, so you need to be smartly dressed, well turned out, same as you would do at a face-to-face interview, and as best you can make sure that you're there on time and you've got a reasonable Wi-Fi connection, because there's nothing worse for both the panel and the candidate if the signal keeps dropping halfway or partway through your interview. And set the my last tip would be, make sure that you set the camera up so that your face is taking most face and shoulders. Just think of a passport photograph is taking up the screen, because the last thing you want is to be able to see the top of somebody's head or looking up somebody's nose because they've got the camera on there. So just make sure you set the camera up right. Thanks.
And sometimes people even invest a little bit of extra tech, like I've heard colleagues talking about having a ring light to provide a little bit of extra, support so that they look a little bit better. And it just gives you that little bit of extra confidence, like wearing something nice, just everything that you would do in a face-to-face interview to give you that extra bit of confidence. That's why we wear, our best clothes, and we make sure that we're well presented. We shouldn't change our eye contact, we shouldn't change our smile rate because we're online. And once again, we shouldn't change the idea of making contact with a unit for a pre-hospital chat, because that can be done on the telephone. You can still speak to people on the wards, you can still speak to doctors who are working there. Yes, it takes a little bit more effort, but it's still possible to have done that ahead of time, just because you're in more of a virtual environment. You might not be able to do it by a Teams call, but you might be able to do it by a telephone call to somebody who's on call. If anyone who has phoned me on call to say I'm thinking about applying to the unit, can we just have a chat about what the job entails, I've never said no, and I'd be very happy to speak to somebody and say what the job really entails. So and I'm sure that everybody else on the panel will be in the same position, because we're generally very keen to have new colleagues and make sure that people are knowledgeable about the area, and about, especially if they're applying from an international perspective. I'm very aware how difficult the medium has become in the virtual context. So I think it's just having the confidence that to use the medium to the best of your ability, and practicing that connection. And if there are anticipated problems with the connection, emailing ahead of time and saying, well, look, there's a connection problem, and and planning ahead for that, because your receiving panel will be sympathetic to that, and they've obviously got their own commitments, but they're keen to interview you, don't forget as well.
So adding on that note, the recent interview I was attending, because you have been given a time slot, and so we expect you to be there on time, and we had a couple of candidates. So one, his excuse was his computer was not charged. So that shows me that you are not prepared for the interview, or you are not taking your interview very seriously. So that automatically qualifies that we are no longer interested in appointing you, because if you are not putting the effort to charge your computer, so that shows how much of effort and interest you're showing in the interview. And then again, as Caroline said, you should be smartly dressed. So recently, I don't know whether this is true or not, in one of the foundation programs, a candidate was interviewing and his camera was focused on him, but unfortunately there was a mirror in the back, and he was dressed only up to the waist and he didn't have anything below the waist, and that was reflected in the mirror. And at the end of the interview panel said that, yeah, you did very well, and then they said but the next time when you're on a Zoom camera, do you mind making sure that your camera, you don't have a mirror behind you, because it's reflecting what you're not wearing underneath, and that will be very, very embarrassing. So even if you're trying to do anything like that, please make sure that there are no reflectors or anything like that, and please be dressed smartly, because the last thing you want is someone to not give you the job on the fact that you're not been wearing shoes or you're not been wearing your pants. That's a very shambolic way of not getting a job. Would rather not get a job because somebody else was better than you, but not on the cost that you're not being dressed properly. So treat it like a normal interview, and check your connections like at least half an hour before, and always try to log in at least 2 minutes before, and check all your connections, whether your battery is fully charged, your Wi-Fi is fine, and always have a backup. For example, if your computer has a Wi-Fi problem, have your mobile phone or your iPad so that there is a backup.
The other thing on that note, thinking of previous experience, is that I've interviewed a number of doctors who have actually been on call at the time, and similar to not thinking ahead to charging the phone, they've not thought ahead that they actually need that hour's space around the interview, and they can't be just sort of sat down there in their. I mean, I've no problem if they, do have to do the interview in scrubs because that is the day and they can't swap the day, but to have the bleep constantly going off and halfway through the interview going, just answer that, it doesn't give a good it doesn't give a good impression of somebody that is serious about the job and who's prepared for it. So, do give yourself that time and commitment, because it does pay off.
And to add on that, we recently had a candidate who was on nights, and he just finished his nights and he gave the interview in the morning. So it was quite obvious that he was completely dazed and he couldn't concentrate on. And then he had apologized after the interview, saying that he has just finished his nights. So please take time off. If you have your nights, please swap it with somebody else. It's not the best way to start your interview having finished a full shift of nights. It's not the best way to give an interview, because no matter however you think, you will never be as thinking on your feet at the time when you get caught with a question which you're not prepared for, especially if you have not slept the whole night last night. So please make sure that you have a good night's rest, and then you come for the interview.
I really want this job.
So coming to one of the first questions that we are asked in our interviews, which would be, take us through your CV or tell us about yourself. So what can you tell us about answering this question, and particularly a few things about it, such as how long do we answer this, and whether we prepare for this or just answer spontaneously, things like that?
Yeah, I think I'll start the answer. So I think this is a very important question. Take me through your CV. So basically, this is an opportunity where you can sell yourself, and you should be prepared for this question, because this is a standard question which will be asked in pretty much almost all the interviews, and this is often used as a first question to help you ease into the interview mode. So you should be fully prepared for this interview, because if you answer this question spontaneously, the interviewer will straight away pick up that you are not prepared for this question. So the model which is most commonly recommended is called the CAMP model. So CAMP is C-A-M-P. C stands for the clinical. So your clinical, whatever you have done clinically until that time. So that is what it is. So your experience where you're currently working, so what you have done in the past, So what is your clinical competencies? So this is what should come first. The second thing is academic. So once you finish the clinical mode, so then you go to the academic mode. So this is where you should talk about your research interests and your teaching things. So whether you've got a teaching degree or you're quite keen on teaching, have you done teaching sessions? And on the research, if you've got publications, if you've got presentations, and if you've done any research project. So that's what the academic stands for. So the next one is M, which is management, which is mostly for middle grade or consultancy jobs. Your job, your experience with management. For example, if you have been a clinical lead or you have been a governance lead, or have you actively participated in clinical governance? So that sort of questions. And the last one is your about your personal life. So where you sort of wind down the question by saying that you speak about yourself, your hobbies, your family, and where you live, and that sort of thing. So this gives a very structured answer to this question. And see, this I think probably will be the longest answer you will give in the interview. And always try to answer your questions, pretty much most of the questions, within 2.5 to 3 minutes, because after 3 minutes people switch off. So nobody, you can see very clearly, the body language. If you look at the interviewers, most of them after 3 minutes, they'll start, trying to reach out for their mobile or, try to, play with the pens. So try to structure your answer within 3 minutes. And if this question, if you think that what you're prepared is long, try to, decrease it and, try to, you can actually record yourself speaking for this question and then, replay it and see how you are answering this question, because this is a box standard question. So you cannot faff here. If you don't answer this question well, then that gives straight away the impression to the interviewer that this guy is not even bothered to prepare for a question which everyone is getting asked. The other thing, one thing which I want to tell is that you'll be very surprised. Recently in a consultant interview, when someone was asked about this question, he started with, I was born in this year and I did my primary school here. Nobody is bothered about where you did your primary school or secondary school. So that's a very poor way of answering a question. And straight away the interview panel, all of them were switched off. They started, just going into their own modes. So please, what they want is, the most important thing is what you're doing now. So please, for example, if I'm in a consultant interview and I was asked this question, so basically I started with, I'm currently working as a locum consultant in this hospital and I'm competent to do these procedures. I've done my fellowship. So please go in the reverse chronological order, because what you have done in the recent past is the most important thing that interests the interviewers. Where you are born, or where you did your primary school, nobody wants to know that. So this is very, very important. So go in the reverse chronological order. So nobody wants to know even where you did an MBBS and all that stuff. As long as you can say that, for example, if you're a middle grade job, say that you've done the basic surgical training, I've done these SHO jobs. Highlight any of those jobs which has some relevance to the current role. For example, if you've done in your rotation, for example, registered rotation, so you're applying for a knee fellowship. Because I'm an orthopedic surgeon, unfortunately, I give a lot of analogs regarding orthopedics. So if you're going for a knee fellowship, so highlight those registered jobs where you have worked with the knee surgeons, what you have done, because that is what the panel will be quite keen on, listening to. So prepare yourself like that. But the CAMP model is a very good model. It can be used for most of the answers, and for this answer, it's the most ideal, model. Thank you.
I mean, I'd fully support that, and just say make sure that you give enough information to sell yourself, but not enough so that you're just waffling on about, every job and everything that you've done. And again, in the personal bit, flag up those extra things that just make you the individual that will stand out.
I think it's a really tricky question to answer as well. I think the candidates that scored most highly on this question are the ones who can think about their CV and think about themselves. It's again where the A level in yourself comes out, and how they apply to this particular job role. So it's thinking about, what is it about my CV that particularly makes me the star candidate for this role. So I have done, I've been a middle grade for the last 5 years, and I have got, a great experience on labour ward. I've been running the labour ward independently, or I've been, I can do colposcopy or whatever it is. And we're talking about this because we're obstetricians and gynaecologists. But whatever it is that gives you the edge that will make it seem like, yes, this is a very relevant bit of information for me clinically. Academically, I can teach, managerially, I'm aware of the governance processes in my own unit, but I'm very keen to learn about them, and professionally, I'm the captain of my cricket team or whatever it is, so that you show, it's like, it doesn't have to be a 5-minute answer. It's just a quick guide to, oh wow, this person's really nice, interesting, well-rounded. Just that gives us a quick taster. And then if there's time, you can go back and fill in the headlines that you've given. Because sometimes we get lost and we're looking at the clock going, oh, we've only got 4 minutes left of this interview, we're not going to get any more information out of you. Because don't forget, we've got to try and score as many points during that 22 minutes or whatever time that we've got. So you've got to think about how much time you've got in that interview to score points.
Thank you for that answer. Now, coming to the next bit, another constant in most of the interviews is the clinical scenario bit. So what are your recommendations on preparing for that? Do we read up on generic questions on the specialty or on ethical scenarios? How do we go about that?
So coming to the clinical scenarios, so most often, the reason why they ask the clinical scenarios, the basis is that you test your clinical knowledge. So often the questions that asked are, conditions which are quite difficult but should not be missed. So those are the clinical scenarios which we normally ask. For example, if you're in a surgical interview, so most often scenario will be asked is a patient who is post surgery, and he's not in the evening, so after the surgery. So the nurse is bleeping you, saying that the patient is not responding well and he's feeling a bit drowsy. So basically, they want you to find out the most common complication after the surgery is bleeding, and they want you to identify that, and then pick up the vitals, check the vitals, identify that, look for the blood pressure, the pulse, and those, check the vitals, make sure that you do the immediate basic management, which is like starting an IV fluids, and then putting oxygen onto the patient, arranging for bloods, and then escalating it immediately to your seniors. So the clinical scenarios are primarily want to make sure that you are a safe person. So nobody wants you to know how to do an appendicectomy or how to fix this fracture. Nobody asks that. So the most important clinical scenarios will be that are you a safe doctor? So will you be able to pick up an emergency situation before it becomes unpreventable situation? So you should be able to pick up those vital clues, and then you should be able to implement the immediate treatment for the patient, and then escalate it. So that's a very important thing. So if you don't escalate it, then you're not a very safe doctor. So most of the clinical scenarios will be based around this situation. Like for example, in orthopedics, it will be a vascular injury. So they will try to find out whether as soon as you know that the pulses are not palpable, it's an emergency. So most important thing is that you immediately check, sprint the patient, immediately inform your seniors, make sure that the patient is comfortable, arrange for the theatre, speak to the vascular surgeon who is around, make sure that you get everything ready. So most of the clinical scenarios will be based on how you manage an emergency patient, and whether you are safe enough to handle the pressure, and whether you pick up the clues or the cues that suggest that the patient is in danger, and how you avoid the danger. So most of the clinical scenarios, at least in orthopedics and surgical specialties, will be around that, and you should have a standard answer of how to finding these clues.
So I think from my experience of generic interviews, certainly the entry level for ST applications, they don't tend to do specialty specific clinical scenarios. What they do tend to do is these safety decision making. So you may get in obstetrics and gynaecology, for instance, you may get a medical scenario, and that can throw candidates off because they're expecting they've prepared for potential obstetrics and gynaecology scenarios. But what it is, it's checking as Pregash has said, it's checking about safety decision making and prioritisation. And sometimes you'll get several scenarios to deal with and triage and work with a team. And so that's why you may need to be thinking about at the ST entry level about prioritisation and about your clinical decision making. So it shouldn't be something that throws you off guard. It should be something that you're used to doing already, working with your ABCs, working with the clinical information that you've got in front of you. And then when it comes to middle grade level jobs, it probably will be specialty specific, and once again it will be potentially a triaging clinical scenarios that you're used to working with. So it should be your everyday work and something that you're very familiar with. So it shouldn't be, once again, something that throws you off guard, and you'll just go back to first principles of triaging. And if you need to ask for more information, you should be very happy to do so and say what you need to make those extra decisions and ask for more clinical staff. It's about safety generally.